So welcome everybody, those who added to the group, which was already before at the workshop here. Great that you came here also, and we have made this also part of our lecture series, Planning in Transition. And I'm really grateful that Nevin Cohen, that we can greet him, and that Nevin is here and is going to talk about digital food systems, new challenges and opportunities for urban food policy making. And Nevin is professor at the City University of New York, School of Public Health, and he is at the same time also at City University director of the Urban Food Policy Institute. So, and has also published widely in this field. So really one of the central persons, I would say, in this whole area. And I'm really curious now about your talk on digitalization of food systems and the policy consequences and impacts maybe of that. Thanks so much, Nevin.
Thank you, Harold. And I want to thank you and Mohsen and the university for inviting me here today. And thanks for you listening to my talk and for the people on Zoom listening. I'll present for a little bit less than an hour and then give us a chance for questions and answers and hopefully discussion. But the title of my talk is a bit cliche, but it's bite back. It's thinking through how digitalization is changing food provisioning, buying food, using food, and specifically what the positive and negative impacts are, how we can begin to measure them empirically more carefully, and then come up with policies and programs to ensure that as digitalization unfolds, that it is leading to a more just, healthy and resilient urban food system, and that the negative impacts are addressed through public policy. So that's the focus of my talk, and it really was an area of interest to me because I've been working, as Harold said, in the food policy field for a couple of decades now, and in my work with cities in like New York and other cities around the world, I've noticed a wide range of public policies developed to address a lot of inequities and inefficiencies in urban food systems. And cities around the world, members of the Milan Urban Food Policy Pact, for example, have developed a wide range of food policies, from economic development policies to encourage new supermarkets to open in neighborhoods that don't have sufficient food retail. In the US, we have an enormous problem of food insecurity. In New York City, for example, 15% of the population is food insecure, and probably another 20% or 30% of the population is at risk of becoming food insecure. And 20% of New Yorkers depend on federal food benefits, the Supplemental Nutrition Assistance Program, to pay for the food that they feed their families with. And so social service agencies have developed funding for emergency feeding programs, food pantries, and programs to sign people up for benefits. So these are a range of different agencies in cities and the types of policies they've developed. But what I'm arguing today is that as cities design and implement these policies, the foundations of that system are shifting as a result of digitization. And by digitization, I mean the specific technologies and applications and the people and practices that use those technologies are changing the way the food system operates, and as a result has affected the entire food supply chain from farmers to consumers. And some of the most important changes caused by digitization, particularly for urban planning and public health and food provisioning, are the bundles of practices that consumers are implementing to get food in the new digital food system that will, I'll argue, either make irrelevant or contradict existing food policies that cities have tried to implement. And if we don't pay attention to digitalization, we may find that the policies we've been working on for the past 20 years are irrelevant. So that's the danger. I've highlighted some of those, for example, policies around the world to support supermarkets to open up, maybe obviated by food retail through digital means. Policies that cities are trying to implement to restrict unhealthy food marketing are being subverted by the use of digital food marketing through social media. Support for informational regulations, calorie labeling, labels to warn people against high salt and sugar content in food, also may be sort of overwhelmed by digital systems that lock people into certain food purchasing practices. Support for emergency feeding, like food pantries, may be affected by the way people learn to buy their food and the sort of urban food mobility patterns that they practice in moving around the city to get food. So I'll discuss some of these as we go along. Digital food provisioning includes e-commerce, food retail channels that have transformed how some consumers select and buy food. And these have affected land use, transportation, and everyday urban mobility patterns for consumers. This is a photo of Amazon Fresh's prototype physical retail store. Food retailers are experimenting with omni-channel means of selling food to consumers, meaning digital channels for some consumers and physical brick and mortar stores for other consumers. And the growth of e-commerce is affecting land use patterns and transportation patterns and urban mobility patterns in cities around the world. New digital platforms that can connect consumers, retailers, and workers through apps and GPS-enabled mobile devices have changed the market for home-delivered food while also creating a large and precarious and underpaid labor force of food delivery workers. I mentioned digital marketing a second ago, but predatory digital marketing counteracts public health information provided by cities. Digital marketing of food has become ubiquitous, targeting in predatory ways. So there's always been targeted marketing of consumers, but predatory targeted marketing means targeted marketing to consumers who are particularly vulnerable to buying inexpensive, unhealthy, ultra-processed food. And we're currently at CUNY finishing a study of how young New Yorkers have been exposed to multiple forms of predatory food marketing in the physical environment through billboards, but also in their social media feeds. And it's the first study that I know of to look at how the interactive effects of both social media and other kinds of digital marketing and physical traditional marketing in the urban food environment affect the perceptions of young people about the food that is appropriate for them to consume, that is available for them in their communities to buy, and that they should be eating. So there are three really important key questions that we need to answer, and we don't have the answers to all of these, as I'll point out in the rest of my talk. But the first is, what is the scale of change? Is this really a phenomenon that we really ought to be paying attention to, or is this something that is temporary, ephemeral, not very big in the scheme of things? Second, what are the anticipated effects? Effects on health and well-being, on city life and urban resilience, and on food labor and worker health and safety, because too seldom in the food policy world, we've paid attention to the effects of policies and programs and food systems on food laborers. And third, what policies and programs can help us avoid negative and foster positive impacts as digitalization unfolds? And many of these changes have emerged in just the past decade, with adoption accelerating during the pandemic. The pandemic distancing precautions, stay-at-home orders, new technologies being emerged, lockdowns, businesses having to change their business model, caused consumers and businesses to shift to online sales channels for food provisioning, potentially permanently altering their everyday food practices, the everyday food practices of consumers. While many people have resumed going to restaurants and shopping in brick and mortar stores, and frequenting other physical businesses, the restaurant business has significantly rebounded in many cities, though not entirely. Online food buying for both groceries and prepared meals continues to grow. And this is an example of how how rapidly a seemingly entrenched set of practices, like going to the grocery store for your food, or if we think about it, going to the office every single weekday of the week, can actually change very rapidly, and the perils of not imagining and planning for significant socio-technical shifts that occur because of a crisis like the pandemic or because of new technology. I just read a statistic last week that in New York City, still office buildings are only 50% full during the weekday. And so these shifts can be significant and long-term. The effects of digital food provisioning will have positive and negative effects on public health, social justice, and the cityscape. And we're only beginning to measure how the shift to online food provisioning may change the food that we buy and consume. I want to sort of take a moment to think about the trajectory in the market for digital food provisioning. And I'll tell just a basic, a short backstory. When I was a poor adjunct professor trying to make ends meet, I actually took a job working for a company called eMarketer, a market research firm that published data about the adoption and diffusion of internet technologies and how consumers were adopting the use of e-commerce. And what I learned from that experience, I was there for 4 years. We aggregated, organized, analyzed other market research, and we produced our own estimates. The market research industry is not a very reliable and rigorous industry in terms of the methods that they use to analyze market share and market growth. Nonetheless, I want to show you a few statistics that indicate to me that digital food provisioning is going to increase. So take these statistics that are coming from a company called Statistica with a grain of salt, but because often companies do straight line extrapolations of previous trends. A lot is happening in the global economy that creates uncertainty about the next several years. But the general consensus is that grocery delivery is growing rapidly and is expected to continue to grow at about a 24% annual growth rate per year. The chart shows the combination of retail grocery delivery, the large black bar at the bottom, something called quick commerce, 15-minute delivery services that tend to provide not just the bulk of what people buy during the week to fill up their pantries, but items that they buy to top off their weekly purchases, so milk and eggs and other essentials. That's a growing industry. And then the meal kit industry remains very, very small, but is expected to continue to grow. Meal delivery is just a clarifying question or a...
There are two questions. Maybe people cannot hear us. We can hear you.
Yes, I can repeat it.
There are two.
I see. So I don't know how we're handling the questions from the audience.
No, it doesn't work on this.
Someone else will have to zoom in and ask those questions. Okay, sorry. So meal delivery is also growing at a rapid rate. Meal delivery includes delivery by third-party platforms like Grubhub or Uber Eats, and also by restaurants themselves who are taking orders online and delivering. Meal delivery is becoming a convenient, ubiquitous, everyday practice of consumers around the world. Both grocery delivery and meal delivery are accelerating in China in particular, even though the per household or per person amount of purchased is smaller than in Europe and the United States. The number of consumers in China means that home delivery of groceries and meals is rapidly growing in China, and they are per capita larger markets than the US and Europe. Prepared meal delivery in China is particularly large, especially in the largest, densest cities in China. One measure of how online food delivery has reshaped food provisioning is the rate of adoption of the practice within the population. The uptake per capita of online food buying. So market research on the percent of the population using online grocery delivery suggests that by 2027, a third of consumers worldwide will use online grocery delivery for at least some of their groceries. And I say that's an important notion because as online food delivery and food purchasing grows, consumers are adapting their practices. And so they're not shifting entirely from brick and mortar conventional purchases to online, but they're adopting some combination of online and in-person buying habits. About a quarter of the population will order some of their groceries online for home delivery. Some estimates are that 500 million Chinese consumers are expected to use grocery delivery services by 2027, a far bigger market in terms of number of consumers, though not in sales, than the United States or Europe. And other parts of the world, Southeast Asia in particular, are growing very rapidly as well. All this said, I've tried to convince you that the market for online groceries will continue to grow, but the absolute numbers show that online food buying will still be a relatively small percentage of the products that people buy. So the percentage of people, the percentage of revenue, sorry, of purchases online will be about 6.2% by 2027 compared to offline purchases. Nevertheless, a shift to 6.2% purchasing is a significant shift, I would argue, in terms of changing practices. And this only takes us out to 2027. Over the next several decades, we can expect that percentage to continue to grow. And I'm not a techno optimist by nature. I recall, however, when I worked for the market research firm investigating the adoption of e-commerce at the turn of the 1990s, there was a huge amount of skepticism that consumers would buy anything except books and CDs online, right? And people buy clothing online. People said people never shop for clothing online. They have to try it on. People said people would never buy furniture online. And I can go through the list of consumer items, but people very rapidly got used to this concept of being able to buy things online and return them and comparison shop online. So I think we need to really be open to the possibility that this is a real significant trend that will reshape our cities. So what are some of the anticipated impacts and responses? Let's think about public health first. Digitization of food retail, particularly the adoption of online ordering systems, platform-based delivery systems, and choice-mediated apps that help you decide what to buy and guide users to specific types of purchases have both positive and negative effects. In theory, digitization can make food provisioning more convenient and quicker and potentially less expensive. resulting in health benefits for populations with insufficient income to afford healthy food, but they can also limit choices, locking people into potentially unhealthy buying patterns. If you've shopped online, how many of you have noticed that there's always the previous shopping basket that you ordered in the past? And how many people reorder those shopping baskets? A lot of people, including myself, to save time, to save cognitive energy in thinking about what I need to buy. And that lock-in is a design feature that the e-commerce firms have finally honed to cause people to easily spend the same amount of money each shopping experience, but that also reinforces patterns that, if they are unhealthy to begin with, get reinforced over and over again. And so it's hard to sort of undo lock-in. To understand the effects of digital food provisioning, we need to borrow from practice theory, the approach of understanding motivations, perceptions, know-how, and the material aspects of the food environment in different contexts. Understanding how and why a digital system is used to get food requires looking beyond conventional variables used in innovation diffusion research, like how useful a new tool or method is compared to the status quo or the old system, but rather understanding the complex interactions among the wider variables and whether and how their configuration changes everyday practices. For example, in one study of online grocery buying practices, comparing German consumers to American consumers, in terms of individual motivations, and this is based on survey research, Germans were found to be more sensitive to cost savings from online ordering, while US respondents were more focused on time savings. So thinking about bundled practices of actually moving around the city to shop for food versus the practice of economizing on food is important to understand those differences. Access to a wider range of products not found in brick and mortar stores also motivated German respondents to shop online, while US respondents focused on the reduced stress of online versus in-person shopping. And that has to do, of course, with the nature of retail in the two different countries. Smaller shops, maybe smaller variety in each individual shop. In the US, larger distances between home and supermarket traffic, the use of cars versus walking or transit. So understanding the material dimensions can help us understand the difference in motivations and practices in different contexts. These different perceptions, concerns, and motivations are a function of really different food environments in each country. And so one other example, the ability to eat more nutritiously was only a factor driving 2% of the US respondents and 10.8% of German respondents to shop online. So understanding know-how about food and nutrition, understanding the difference in values from place to place is really critical. When we think about public health in the US, a critical focus is on food access and food security. As I mentioned those statistics earlier, a large number of Americans in general and urban Americans are food insecure. And in public policy, there's been a major effort to so-called sort of green food deserts. I hate that terminology because it implies that neighborhoods with fewer traditional supermarkets are deserts. They have lots of resources. They just don't have large supermarkets. But we've been involved in a project to create an online food environment equity dashboard for New York City, where we're trying to use data and present it and visualize it in different ways to change the narrative about different aspects of the food system. And one of those narratives that we want to change is the food desert narrative, because in places where poverty is a driver of food insecurity, the cost of food is a much greater barrier to eating healthy than the location of a supermarket in your particular neighborhood. And in a large city like New York, there aren't really food deserts in New York. People often skip 4 or 5 supermarkets to go to the supermarket that they prefer to shop in. And often that preference is driven by the perception of value and the cost of food. So what we did was we did a number of things. I'm not going to show you all of it, but we scraped the web to find prices and found that the prices vary from supermarket to supermarket, even within the same neighborhood. this graph shows data from a company called SafeGraph, which mines mobile location data from all of the cell phones and watches and iPads that people carry around with them to understand the home location of consumers and the stores that they shop in over time. And they aggregate, they anonymize, and then they sell that data to companies that want to know where to locate a new store in a city. So we took that data and we looked at the percentage of the grocery visits that people make from their home community district to another community district. And we overlaid that, you can't see it on this map, with the percent of the population that is rent burden. And what we found is a large variation in the neighborhoods in which people have to leave their neighborhood to go and get food. But there are significant parts of the city where a large majority, up to 87.3%, that's the extreme on the graph, actually have to go out of their neighborhood to shop in the supermarket that they prefer. So what that tells us is that, what it tells me, you don't have to agree with me, is that online distribution, online ordering of food can help to equalize the burden of people who travel outside their neighborhood, and might cause us to have to redefine the concept of food desert and reconsider the attributes that we focus on when we develop policy to make it easier for people to buy healthy food in their community, and focus on price rather than the physical brick and mortar stores. What we found in a study that we conducted pre-pandemic in a social housing development in Brooklyn, we organized residents, this is a community-based participatory research project, we organized the residents of this public housing development into a food buyers club. And this was when consumers that use SNAP benefits, the federal food stamp benefits, were first able to shop at Amazon. And we organized the residents, we asked them, what their needs are. They wanted greater variety, ease of shopping, and we helped them organize a system that made buying on Amazon and buying at a local grocery store through a company called Instacart, which picks up food that people order online and delivers it. The residents of this housing development organized a system that worked for them, in which Amazon and Instacart delivered to the community center at the housing development, and the individuals helped to redistribute some of those packages to residents who are mobility impaired, but also picked up at the community center. We studied whether people saved money ordering, whether they bought different things online versus in their brick and mortar stores, what percentage of things they ordered online versus in traditional supermarkets. One of the key findings was that the time saved in shopping was the biggest value gained by shopping online. The actual prices that and this shows the average spend at conventional supermarkets that people actually shopped in. They kept their receipts and we totaled their receipts. The round trip transit cost, the out-of-pocket cost to taking a car service, an Uber, or the subway, and the time that it took them to get to those different locations, and we attributed an amount of value to the time that they spent, and the round trip travel costs as a percentage of their grocery costs. And you can see in some cases it's extremely high percentage of their grocery spend is spent on actually traveling to the store. And we also looked at the prices that people were paying online versus in store, and we found that the online prices were actually higher than the brick and mortar stores, but people nonetheless did the calculation in their head, as people always do, what's the biggest value for me, even if the prices are somewhat higher when I shop online, is it worth it? And through qualitative research, interviews with people, we understood why they were making those choices. One woman said, she had to normally take her child and drop the kid off at her mother's to go shopping and spend basically the day shopping, and then pick the kid up with the groceries and go back to her apartment. And you can quickly understand why people make the choice to pay a little bit more to get that convenience. And the quantitatively, it makes sense too if they're spending a high percentage of their grocery spend in transit. In theory, online retailers increase competition within the community's food retail marketplace. And in neighborhoods with few existing physical retailers, the increased competition from online channels may result in business decisions leading to better quality, value, and possibly lower prices. Simple economics 101 competition might, in theory, lead to better prices. These changes in the community scale consumer food environment may take time as people gain know-how to comparison shop more effectively online. Interestingly, there's a lot of market research being done by online firms to figure out what drives consumers to shop in particular ways online. And as planners and public health professionals, we need to actually immerse ourselves in the market research literature to understand what is going on, or at least to understand what the corporate sector is thinking is going on and trying to anticipate their responses to that market research. But one study showed that when online shopping experience increases, consumers comparison shop across different online retailers and search more often for better quality, lower cost products. But there's contradictory research. Market research also shows that households are less price sensitive when shopping online, which may result in online grocers charging higher prices than brick and mortar stores. It's also a user interface and design issue. It's often harder to find price promotions on online sites than it is. I don't know if you have them in Sweden, but paper circulars that people use to shop weekly, where they can find where the best discounts are. Online grocers do have those price promotions, but they're harder to use. And there's also market research to suggest that even if they're equally visible, price promotions have a higher impact on brick and mortar consumers than when food is purchased online. So if you think about that, that contradicts the idea that online may offer more competition and change prices. On the other hand, it suggests, I think, a policy intervention that could be useful in helping consumers to be better at consumer economics when they shop online, or to find ways to promote better consumer comparison shopping online. The map I posted is from USDA's Food Desert Atlas. By law, Congress required the USDA to publish a food desert atlas. So what USDA has done is looked all across the US to find communities in bright green that have insufficient levels of food retail. What you see from this food desert atlas is that a lot of the food deserts are actually not deserts, but they're rural areas. And one of the questions is whether online food retail can actually meet the needs of communities that have insufficient retail, if most of those communities are places that are highly dispersed. Because one of the reasons that online commerce works is if the delivery costs are reasonable. And there have been several studies to show that rural areas in particular are underserved by online retailers in large measure because it's just too costly for those retailers like Amazon to ship to people's homes. We've been working with a community in Mississippi that has built a food hub in rural the community of Jackson, Mississippi, and they've received philanthropic money to buy a truck. And what they've done is they've organized the community to order online at various retailers, from Walmart to a local independent grocer. And they pick up the groceries at those retailers that happen to be 20, 30 miles from the average person's home, and deliver it to a food hub. And the consumers go conveniently to pick up their groceries once a week at the food hub. The food hub also serves as a hub for people to learn about nutrition, access to public benefits that they might not be, they might not think that they're eligible for, they might not be enrolled in, and it helps to build community. And so we can begin to think creatively about blending the commercial online e-commerce products like Amazon or Walmart's regular e-commerce sites with a community-based interface that can help make that more feasible and practical for residents, and also serve to create other benefits like creating a space for people to come together to learn important information and share information. Can e-commerce or digitalization shift diets, and what might that mean for nutritional health? There's some empirical evidence to suggest that online grocery shopping and the temporal disconnection between shopping and receiving food may lead to healthier purchases, right? The theory is that if you can't buy the candy at the end of the aisle in the supermarket and you're waiting for a day for it to be delivered, the instant gratification is no longer there, and therefore people make fewer impulse purchases. The other theory is that the visceral and sensual experiences of food that you experience in the supermarket is different when you see a two-dimensional picture online, like the bakery in the supermarket on the left versus a picture of a package of donuts on Amazon Fresh. And that difference actually causes people to be less impulsive about buying unhealthy food online compared to in a store where it's enticing. They might say, well, it's also enticing to see fresh vegetables. And if they're also not enticed to order fresh vegetables, what's the net effect on people's nutritional health? We don't have good empirical evidence right now to understand that, but there's beginning to be empirical data, right? So a recent study found that online shopping was associated with lower spending on certain unhealthy, impulse-sensitive foods. Other research has found that consumers are likely to buy fewer vices in an online than an offline shopping environment because of the visual presentation on the web. But a study of online versus in-store purchases of unhealthy food found that shopping online was associated with lower spending on candy, cold or frozen desserts, or grain-based desserts. Yet another study found that online consumers made fewer purchases of candy and savory snacks with no measured compensation for online purchases at other online retailers or brick and mortar stores. A study of households who purchased groceries online found that online buyers had a 70% lower odds of frequently buying fruit, fresh vegetables, meat, and seafood compared to purchasing those items in a brick and mortar store. And a qualitative research study found that mistrust of the selection by grocery shoppers, like for Instacart, and the inability to check the quality of fresh items was the major reason for not buying fresh items online. Now, the reason I jumble all of these together and read them to you very quickly is to also point out that we don't have good empirical data, that we have a number of different studies that have come out, often with small samples surveyed, often of people surveyed not measuring their actual purchases, where the measurements of actual purchases. We have questions about the reliability of those samples and that data. This is a really good opportunity for the students online and in the room to think about projects that they may be interested in doing. We need better empirical data to know whether this shift to digitalization leads to changes in what people buy and whether that is net healthier or less healthy. This is just some market research showing that soft drinks and juices are the major types of groceries and beverages purchased online by category in the US in 2022. That's not surprising because if the convenience of ordering and having stuff delivered to your home is a major motivation for online shopping, then naturally the heaviest items are the things that people will shop for online, and that includes sodas. And if they're sweetened beverages, that is a major contributor to cardiovascular disease. I mentioned choice-mediated apps before. Are these healthy guides or marketing lock-in? So the left is a product that the company Instacart recently rolled out. It's an app that you can use to search by what they call health tags. So they've gone through their inventory of food. Instacart, for those of you who don't know what it is, aggregates websites from dozens and dozens of supermarkets in the cities in which they operate. And they have shoppers in each of those stores picking the items off the shelf that you order, and they provide the delivery service to your home. So they're a platform for multiple types of retailers. So what this platform did was tag items as healthy. They have other tags that can help you if you're diabetic or if you are gluten intolerant, et cetera. Is this choice mediated app really having an effect on people? We don't know yet. The lock-in I mentioned earlier is the screenshot from my last purchase at Amazon Fresh, which comes up every time I go to reorder. You know, is that locking people into patterns that are unhealthy? Apps are becoming more sophisticated. They're offering entire meal planning advice. So there are apps that allow you to say, I'm having a dinner for 4, 2 people are gluten-free, and one's vegetarian. Prepare a menu for me and show me the ingredients and give me a place to click where I can order them to be delivered to my home tomorrow. And now, if you've read stories about ChatGPT, you can do the same, right? You can ask for suggestions for menus. For low-income consumers, this is a particularly important issue because they have less money to be flexible with their purchases, and those purchases need to be healthy for them to avoid cardiovascular disease, and the disparities in cardiovascular disease and other diet-related problems of low-income consumers versus average income consumers is huge. And so if, as planners and policymakers, we care about reducing disparities in diet-related diseases that are often, at least in the US, based on race and immigration status, what role can the online food environment play? The USDA was mandated by Congress to allow SNAP recipients to shop online. And in 2019, they rolled out an online program for supermarkets to allow people to shop with their electronic benefit cards using their SNAP dollars. So this graph is from February 2020 to March 2022, showing the SNAP expenditures at internet retailers. This is still a small percentage of overall SNAP expenditures. Only just about 5% of SNAP expenditures are spent online, but it's a huge increase. And as SNAP participants are growing in age, and so that the age range of SNAP participants who have had experience using computers and ordering online increases, and as cities have developed policies to allow for free Wi-Fi in low-income neighborhoods, as New York has done and other cities have done around the world, online ordering by low-income consumers will continue to increase. We don't have data on what SNAP participants are buying online versus other online consumers. In the Farragut project that I mentioned earlier, the project with public housing residents, we looked at their online purchases and their in-store purchases, and they were almost identical. They were statistically identical. And so we expect that nationally, the types of purchases that people shop online for are going to mirror the types of purchases they shop at brick and mortar stores for. And data has shown over the past 5 decades that SNAP participants buy roughly the same types of products as average Americans who are not participating in the SNAP program, middle income Americans. So we can begin to predict the patterns of shopping online for low-income consumers, and we can begin to think about policies that might be put in place to help those consumers make healthier choices when they shop online, and potentially policies that would require informational changes at the websites of online grocers who accept SNAP benefits that might require them to preferentially put healthier items higher up in the screens of those consumers, or to provide guidance as people make choices to fill their shopping cart that they may want to substitute certain products for others that are healthier. One project that we've been researching is geared at very low income residents in New York who rely on emergency food pantries for free food. There's a very large emergency food pantry, the West Side Campaign Against Hunger, and there's now a network of food pantries in New York, about 100 of them, that have coalesced and adopted an app called Plentiful. And this is an app that allows people who need food pantry food to order online so that it allows them digital choice. It allows them to pick the food that they get from the pantry. It allows them to set a time to pick up that food. And the goal is twofold: to allow people to get the food that they want to eat, that they feel is preferable for their families. And secondly, to prevent people from having to stand online outside a church waiting to pick up food, because that is stigmatizing. And it's a high-tech way of ordering food. And why shouldn't people who get food from an emergency food pantry have the same technology that people who shop at Amazon do? These systems also improve efficiency because the food pantries can then do better planning and see what kinds of foods are ordered more. They can begin to search for those kinds of foods. They can then, it hasn't been done yet, but they can use the Plentiful app to help guide food pantry clients to pick healthier choices. This is so important in New York because, as I mentioned earlier, I gave a percentage earlier, but it's about 2 million New Yorkers who are food insecure and who depend for some portion of their food on food pantries. So it's not an insignificant part of the population in New York City. There's another part of the population in New York City that's important, and New York is about 50% immigrant. Some percentage of that population is undocumented, and those people who are undocumented can't sign up for SNAP benefits. And so what New York City has done is created a separate program to stipend people who are pre-diabetic, diabetic, or have other diagnosed cardiovascular diseases, and who are participating in a New York City Health and Hospitals Corporation program. New York City Health and Hospitals Corporation is the city's public hospitals for undocumented households. So this is a way for the city to define this population of undocumented New Yorkers who have need for healthy food. And the city has partnered with a private company called Mercado, who sets up e-commerce sites for independent grocery stores. And so the city wanted to make sure that the city was supporting independent grocers and not Aldi and Amazon through this program. So the food is distributed through independent grocers. The participants are people who could not get public benefits otherwise. And the roughly $350 per month per household of 4 that they get can be used to order online, and that money can also be used to pay for any delivery charges there are, to make sure that households with mobility problems can also get food conveniently delivered to them. So it's an experiment. It's just starting, and we were just hired to be the evaluators of this program. We don't know if it's going to be successful or a flop, but what we're interested in evaluating is not just whether people are using the program, but what portion of their food provisioning this program is providing, and whether the products that they're buying through this program are materially different, potentially healthier or less healthy than the products they're buying in brick and mortar stores, and how this population compares to a comparable group, not a control group, but a comparable group of people with the same demographic characteristics. This is to be continued. If I come back next year, I can give you some results of this. This is the project I mentioned earlier, so I won't go over it again, but it's the project in Mississippi to also help people in need of being able to have the convenience of ordering online, but creating a food hub for them to interact with and to get additional services through. I realize I will begin to move more quickly. What are some impacts on the urban food environment? The urban planning effects of increased digital food provisioning are likely to vary as well. These include things like ghost supermarkets. This has been a big issue in Europe and in a few cities in the US. These are locations often on high streets or commercial corridors that are taken up by companies. Getter is one of those fast delivery companies, 15-minute delivery companies, as mini warehouses and distribution sites for their products. What this means is otherwise vibrant commercial spaces are being used for wholesale purposes. And because these are distribution hubs, there's often traffic at these locations. And sometimes they're in residential neighborhoods, so they're in the wrong zoning because there was a supermarket that had been grandfathered in a residential zone that is now occupied as a ghost supermarket. And cities around the world are beginning to sort of take action. In Amsterdam and Rotterdam, city officials are trying to figure out how to use zoning and regulations to counter dark supermarkets. And Barcelona just passed a ban on dark stores, including dark kitchens, which are the prepared meal analog of the dark supermarket, where a number of restaurants will rent a common kitchen to prepare meals for delivery to consumers instead of operating as normal restaurants. We have to be cognizant of changes to mobility patterns as people begin to shift some or then maybe all of their shopping from brick and mortar stores to online. One of the biggest sources of physical activity for older adults is shopping. And it's also an important place to socialize. And so we have to be careful. On the one hand, for example, USDA's Snap Online program was advertised as a way to help seniors get food delivered to their door. On the other hand, if that means that the time that people would spend in a store shopping is spent at home instead of in a different activity that might also be physically healthy and expose people to other people in their community, then the net change will be negative on people's health. There are also urban planning impacts to the food industry. There have been studies by consulting firms like Ernst & Young and others that are showing that the platform companies like Uber Eats that are making it so easy for consumers to buy from restaurants are actually doing two things. They're cutting into supermarkets' profits by charging fees to supermarkets, and they're also shifting the way consumers are using restaurants. So if consumers are not eating in person, the revenue the restaurant would get from a meal typically includes beverages, specifically alcoholic beverages. And so if people are ordering at home, that has a severe effect on the restaurant's bottom line. And so this shift may be increasing the number of meals sold and served and sold by a restaurant, but it may be decreasing their net profit. This is data from a study that the Department of Consumer and Worker Protection in New York City did of the food delivery workers in New York City. But it's a chart showing the economics of app delivery. So if a consumer pays $33 for a meal from a restaurant, the restaurant gets $18 of that. The fees charged the consumer are $3. The app takes $5.50. I'm sorry. So the app revenue is $8.50, and the amount for the delivery worker is a pittance. It's like $4.32. And so this data suggests that the expansion of platform-based meal delivery is not necessarily a benefit to either the restaurant industry or the workers who are working in that industry. And we have to be careful about how those economics work out if, as city planners and policymakers, we care about a vibrant food sector in our cities. I won't go into this, but traffic and congestion are obviously a big concern with an increase in home delivery of both groceries and prepared meals. This innovation from the Netherlands, brought to New York City, of a cargo bike is one potential solution, and all of the large platforms and food delivery companies are implementing these technologies because they know very well that the negative perceptions by the public and lawmakers to traffic will wind up causing them a greater headache when regulations prohibit double parked trucks and the number of vehicles on the street. And so I think they're proactively trying to fend off greater regulation of traffic congestion by showing that they are using, human powered vehicles as well. So I'm being a little bit cynical here, but I think it's a solution to shift to human powered vehicles. But I think that in many cases it's being used as a ploy by the industry to show that they are being green in their delivery operations. Waste prevention is an important priority of cities around the world, and private companies are trying to create apps that will enable businesses, both businesses that have catering operations and corporate cafeterias and events that they cater, as well as supermarkets that have food at the end of the day that's not going to stay the next day or the day after because it's not fresh anymore, to sell it at a deep discount to consumers. So this is an opportunity for people who have some flexibility in how they buy food. This is a change in practices. We don't know if it's going to have sort of long-term staying possibility, but if consumers are flexible and able to look at the end of the day at 4 or 5 o'clock in the afternoon, what's available at a deep discount at my local supermarket, or can I pick up food from some insurance firm that has had a catering event that day and has lots of leftover. This app can connect those consumers to the sources of food and can be a plus for food retailers who would otherwise have to discard the food at the end of the day. So this is a possible positive use of technology to reduce food waste. It also, by the way, allows the food retailers to collect data that will enable them to better predict how to reduce waste to begin with, because often they don't have the data on how much food winds up at the end of the day being thrown away. This app allows them to have that source of data to then be more predictive about what they prepare during the day. In terms of food worker safety and health, we can have a separate seminar on this. I won't show this graph, but this is a typical experience in a city. This happens to be New York, but it could be any dense city in the world, of a food delivery worker exposed to viruses, exposed to taxi cab doors, exposed to barking and maybe biting dogs. It's a dangerous job. So it's a precarious job and it's a dangerous job. But our question is, as researchers, is the platform itself adding negative health impacts on top of the fact that this is just a lousy job for people to do because they have to ride around the city on a bicycle and pick things up and deliver them to different places? And we think, based on the literature, that algorithmic management, the actual process of having to work for an app rather than a human being, creates additional mental health challenges, and because the apps are designed to increase the productivity of workers through techniques like gamification, behavioral economics tools that encourage people to compete with each other for the best gig, actually causes increased risk-taking, riding through traffic lights and riding on sidewalks, et cetera. And that data seems to be borne out. The New York City study I mentioned found that delivery workers on electric bikes and mopeds have 32 injuries that cause them a day or more away from work per 100 workers. And it's far more dangerous than construction laborers, which typically has been the type of work that is most dangerous in cities. And so this is an enormously dangerous occupation. And what we've been thinking about are different policies that could be put in place by cities to address those hazards associated with the precarity of food delivery work. Some of these have to be addressed at the multinational or in the EU level. Some have to be addressed at the national level, but some can be addressed at the city level as well. One of the key problems with food delivery workers is that the platforms have convinced policymakers that these are independent contractors, right? And so because they're classified as independent contractors, they don't gain the benefits of traditional employees. Even though they have to work, they have to use delivery bikes, they have to follow the instructions of the app, they have still been classified as independent contractors. And there are major efforts underway in European Parliament and in individual countries to reclassify food delivery workers as employees, which would give them paid sick leave and other benefits. Some cities have developed their own worker protection policies for food delivery workers. New York City has done things like prevented or allowed delivery workers to decline gigs that are far away from where they're located, or that require going over dangerous bridges or through tunnels without being penalized by the platforms, without being thrown off the platforms. In France, a similar right to refuse a gig was adopted. Bologna has adopted some occupational safety and health requirements for gig workers. We've been, and I'll skip over this. This is an ad by the So what's going on right now in New York City is an effort by the New York City Department of Consumer and Worker Protection to set a minimum compensation level for delivery workers that would guarantee them the minimum wage, which is currently $15 an hour in New York City for food workers. The city did these calculations and estimated that food delivery workers make on average between $4 and $8 per hour because their expenses are paid for by themselves because they're independent contractors. Their bicycles get stolen. They have to repair them. These are all costs that they are bearing themselves. And the gigs are, the platforms are structured so that it maximizes the delivery efficiency, which means that many gig workers have to wait 10, 12 hours during the day to get a certain number of gigs to make a paltry amount of money. So what the new wage proposals are in New York City are to require the platforms to either pay from the time someone signs onto an app to the time they sign off, an hourly wage that is equal to the minimum wage, or they can pay by the gig, but the amount that they pay by the gig has to, in total and on average of all the employees they have, equal a minimum wage. And this is being fought vociferously by the platform companies who are actually getting delivery workers to rally behind them to oppose this salary increase, because they say that this will result in fewer people being allowed to work for them. So they're saying that they're going to have to have gates on their gigs to prevent more people from doing this work. And it's interesting because it's a typical way that industry opposes any kind of benefit increases. But another aspect of food delivery work is that it is so decentralized that there aren't places for people to talk to each other and organize. And so this is another spatial dimension of platform-based delivery work that is important in terms of occupational organizing and occupational rights. So one of the things that New York City is doing is it's developing parking hubs for platform delivery workers that will do things pragmatically, like allow people to recharge their e-bikes, stay out of the rain if it's raining while they're waiting for the next gig, but also talk to each other and share stories. Because one of the problems of working for a platform where you literally, if you have a problem, you get a chatbot in response, and you can't work things out the way you could work them out with a boss. If you get a bad rating from a consumer, but actually it's because the food was cold from the restaurant that you picked it up from, you can't explain that to a bot. So this spatial solution might be a small step in the direction of creating opportunities for people to work together and organize. And we were working with someone who just got his dissertation defended last week from MIT's Media Lab, who developed something called Gigbox. It's an app that platform workers can use to download all of the data from the platforms they work for to show them exactly how much they earn per gig. And what we're planning to do, we're hoping to get funding for this, is to team up with Gigbox and team up with Los Deliveristas Unidos, the worker organization in New York City of delivery workers, to help workers use Gigbox to make sure they're earning the right amount of money, but also to use Gigbox to collect data from them on their health and wellness, so that we can begin to track longitudinally whether we can associate different aspects of platform work with health outcomes. And so I'll end here and open up to questions with this very complex looking diagram. I began to map out all of the positive and negative impacts of different types of food provisioning that I've talked about in this talk. And then in yellow highlighting some of the policies that could be put in place to address those negative impacts and to emphasize the positive outcomes. And I'll share this with everybody. It would be a nice opportunity to crowdsource solutions to digital food provisioning with a large group of people based on different political contexts in different cities around the world. So I know I've covered a lot of material. I apologize, but I'll end there and take questions and maybe have discussions. Thank you very much.
Yeah, thanks so much, Nevin, for this great talk. We have time for questions still. We'll use the phone, and
are there any
so much for everybody participating online, and just looking whether we probably switch off here the records and go stop sharing. Yep. Because we had, I hope everything worked well on the, I got one message from somebody who could not access, but otherwise it's rather, so the presentation will also be available afterwards. So that's just a question which was there.
I'm happy to share it, yes.
Yes. So questions from here, and I'll take up then afterwards, there's a question.
And hi June, Joe Nasser's partner is online. Nice to see you.
Great. Who wants to go first? Yeah.
Thank you for the presentation. I just wanted to ask, well, I'm from Honduras in Central America, right? And of course, it's a completely different context. But I've worked a little bit with small rural communities, and well, so talking with farmers and locals, right? I mean, sometimes the topic of food security comes up, And they, I mean, they then mentioned the other concept of food sovereignty. So and so this rang a bell when I saw the map of the U.S. right for the food deserts. So I mean, besides the fact that of course it's not profitable for supermarkets to stop to deliver to so long distances, but I mean, do we know if there's acceptance from rural communities? I would guess they're more like prone to their traditional food habits and preferences, to this concept of delivery and so on.
There appears to be a high demand in rural areas for food delivery because the distances people have to travel to a supermarket are so large. The question of food sovereignty is an interesting one, though, because it is so embedded in who controls the data. So in a digital food system, what does sovereignty mean? Our traditional notion of sovereignty is that you get land and you can produce your own food. In a digital world, it has to mean that you have control over the data that's collected by companies, that you have the opportunity to maybe create your own distribution system, right? Because distribution is so important. Production is important, but being able to distribute food from different producers is so critical. So are the tools available for smaller producers? We had some examples of ways that people are trying to integrate food boxes and other programs using digital tools. I guess my concern is that some of the larger digital companies will gain control of the best technologies and not share them. So policymakers need to pay attention to that. Did you want to add something to that? Oh, you want to ask another question? Did I answer your question, or is okay? Thanks.
Yeah, so first of all, thanks, Nevin, for this inspiring talk. And it is so interesting to listen to you. I mean, we've been in discussions and conversations for quite some time, and now having this full-on kind of idea of what you've been dealing with or working on was very interesting. And it goes a little bit, I think, on what you said, or the point that you raised in your talk when you talked about this map of the states with the food deserts, and you came up with this idea of food hubs.
Mm-hmm.
And the way you explained them, I think they're quite interesting. And I think we talked about it a little bit earlier, because actually in Berlin, there are ideas of the Food Council to introduce those, they call it Lebensmittelpunkte. So it's like Lebensmittel is the word of food stuff, but also Lebensmittel are the things you need to live.
Mm-hmm.
So it's things you need to live points, so to say. I really love the wordplay. And the idea is that you have a place in a community or in a neighborhood that offers different access to food in a material, but also in an immaterial way. So you can get, for example, produce from farmers around of Berlin, but there can also be workshops, there can be informational sheets, like you said. And I really like this idea, because even though, I mean, we talked about the Marktschwärmer, this company that is like just bringing consumers and producers together, but like you said, in big cities, I mean, a local producer can't only go to so many places. So you have to think about, if you want to localize, for example, or even distribute food more evenly, you have to think about how to do it in a more also inclusive and environmental friendly way. So I like this idea of food hubs. But what for me was interesting, and I really want to have your kind of maybe personal, but also scientific opinion on it. You said other way around. If we created, I wrote down, if we create food hubs as public food places, do we want to invite Amazon and Walmart? What is your, because you mentioned them in one line, and I was like, for me, it was, okay, food hubs I love, but.
Yeah. No, it's a really important question. So for the residents of the public housing development, the only option for them at that time was Amazon and Instacart. What I found interesting was that first of all, they are well aware of the problems that Amazon has created. Like they're like, we know they have bad labor practices, and this is when Amazon was trying to buy up a huge amount of real estate in New York. It was very controversial. And we know that Walmart's terrible, but we really would love a Walmart next to our so people are aware of the political context in which they're making these decisions. And I think if we have a very sophisticated, open conversation with people, we can maybe try to use the best advantages of some of the large corporations, but then also develop community-based solutions. Maybe that's overly optimistic, because Amazon will come in and sort of model the system that the community creates and just replicate it and make a profit off of it. But I think that we need to think about hybrid solutions to all of these issues. So how can we, maybe use Amazon's distribution system to piggyback the delivery of other kinds of foods? There was a company, a nonprofit company in New York called Corbin Hill Farms that aggregates food produced in the region from farmers and then sells it to very low-income consumers. And they were in conversation with Walmart because Walmart has trucks going from rural areas in upstate New York to the city that are half full or three-quarters full, about using the extra space in those trucks for distribution. So I think in some transitional period, we need to think about hybrid opportunities, but I think the goal should be, and it's my personal opinion, food sovereignty of these digital systems. So how can we maybe begin to experiment using corporate solutions, but then design our own? But that requires informational property law and trademark law to ensure that people can develop their own apps and other systems without interference from some of the large players.
Great. I'll read the question now from June, actually, who joined us from Toronto, and there is later on then one more, but June is asking, you focused on digitization's costs to consumers primarily. What about the costs to environment, energy, and other resources?
Yes, I only touched on a little bit in terms of transportation impacts, but and this is a question when I was sort of thinking about this presentation, like where do you draw the boundaries in the system, right? Because the food system is a much larger system. And I drew them deliberately at the city scale, but clearly, if people are shifting their purchases and they're purchasing through large corporations like Amazon, that has huge implications for the environment because it privileges those large producers that can fit into the distribution network of a corporation like Amazon. So that's the downside. So I think we need to be really careful. I don't think we have the data yet to know how to both replace and subvert those systems. But I think that should be the goal, to sort of have a distribution system that distributes from sustainable producers at the scale and cost of an Amazon. That's a big challenge. And there are competing, of course, competing policy choices, right? Our major focus in New York City is on the huge number of people who are food insecure and just too poor to pay. So the idea of designing a system that's going to be higher cost because it will enable small-scale farmers to produce has to be considered in a public forum very carefully, because we need to make sure that the costs aren't increasing to make more people food insecure. And the policy questions need to be reframed about how to reduce the costs to producers and how to create systems that enable small producers to distribute efficiently. I'm sorry, I just made this more complicated than I didn't answer the question. I made it, but I think the goal has to be to look at the system as a whole, and the goal has to be to reconfigure the whole system so that the environmentally sound producers are the ones who can compete the most or to just change the economic system entirely. And that I don't have answers to.
Great. Is there a question here in the audience? Otherwise, I'll ask a question from a colleague from New Jersey, actually. who has an interest in food policy and the background is an architect. And he asks that you spoke about the effect that urban planning has on food systems. How would you further suggest that he or she tries to integrate that into my work as an architect? Does it have to be done on a larger level like urban planning, or are there ways to direct those efforts towards smaller projects as well?
That's interesting. Yeah, and I didn't talk about that scale of the system, but clearly, if people are moving to digital systems, then that changes questions about their kitchen design, whether they need different types of storage systems. The example of the public housing development was that they happened to have a community center with a bunch of refrigerators that weren't being used. But as an architect, we have to think about, okay, if we have a community center and a social housing development, should it have infrastructure to allow people to aggregate food, whether they buy it online or some other way? But I think the architects have a really important role to play in thinking through these solutions as the system changes. The other example is the bicycle, the food delivery spaces. So if you have a city that has bicycle delivery workers standing in the street next to their cars and no place to go to the bathroom, those are solutions for architects to really think through. What are the needs of people in this new system, and how can they be designed for?
Mm-hmm.
Sorry. Building on that question, if we go a couple of levels more up, in the city of New York, I visited once, and then I recall that you took me to this huge logistics center in the Bronx. I was wondering, on this level of logistics, are there any real changes that we may expect? I could imagine that there's much more crisscross traffic nowadays. But can you answer?
Yeah. So that was the distribution revolution of the last century, which nobody could have imagined would happen so quickly. But the creation of terminal hubs for food was a huge innovation. So two answers. One is there's a new development in this food wholesale hub for, and it's run by the organization that runs the green markets, the farmers markets in New York City. But it's a farmers distribution center that's built right next to the food industry. So restaurants can buy conventional food and locally produced food in the same space, and it provides the farmers with a place to store their food so that they're not going back and forth from upstate New York to the farmers markets 3 times a week. That's a technical solution. In terms of digital solutions or digital problems, because of the digitalization of food buying, companies like Amazon are building their own logistics centers. So it's making the conventional terminal markets maybe redundant. They're finding it more efficient to have distribution centers in New Jersey and Pennsylvania that can serve the New York City market. So we're seeing the development of vast amounts of land in the smaller cities surrounding large cities in the United States with these hubs. They're huge employment centers, not very good jobs, but they're attracting workers. So that's a big urban and regional planning issue that we have to grapple with. Will the old terminal markets be irrelevant in 20, 30 years is the question I would have to ask. And what can they do to stay relevant is another question. Do they become distribution hubs for independent grocers who move online and need a central place to distribute from? Again, I don't have the answer. I can only complicate things more being a good academic.
Great, last chance. We are almost half past. This last slide you had, this mind map, we can't put it up there, but if I understood it, just by quickly looking at it, right on the right hand, you had kind of the positive effects.
No, they were, I'm sorry, I didn't explain it. So the positive effects were in blue. The negative effects
So that's a short list on the
in
positive.
red. Yeah, no, I think there are still more, maybe they're balanced, negative and positive. No, the ones on the right were the sort of public food system, emergency food and food hubs. And the left were the commercial e-commerce systems, but
So, but if you would just summarize kind of the post, concluding also here, the main types of impacts.
being a good academic, I don't think we have enough empirical data to know, actually. Honestly, we have qualitative studies, we have small scale studies. They're not sufficient to be able to make concrete decisions that we can, that I feel are reliable. So I think there's a lot of research that needs to be done. That's always a good way to end a academic paper.
Yes, thanks so much, Nevin.
Thank you so much for, thanks everybody.
And thanks everybody for participating in place and also online, and hope to see you in 3 weeks. We have our next part of this series. Thanks so much, everybody. And hang around. There is also, there are some cakes and some chips outside there.